Hi, I'm Deb Davies. I'm a clinical nurse specialist. I work within the Spinal Injury Centre in Cardiff. I have over 30 years experience with working in the specialist field, and today I'm going to be talking to you about preventing urinary tract infections in spinal cord injuries. I'm very passionate about my job. I love my job. I love my patients, and I'm here today to share my knowledge and experience with you so you can become the expert patient. If after today's session you've learned one tip in how to prevent urinary tract infections, then I have achieved what I set out to achieve. When living with a spinal cord injury, you will face new challenges, one of which will be how to manage your bladder. If you're using a catheter to manage your bladder, there are 3 different options. One would be a urethral catheter, 2, a suprapubic catheter. Both of those, the catheter balloon sits within the bladder, and thirdly is a self-intermittent catheter. Intermittent catheters are inserted into the bladder to drain the urine and then removed, and there are so many different types to choose from. Whichever method of catheter you choose, you have to be mindful of urinary tract infections. Today I'm going to share with you my top 5 tips of how to prevent urinary tract infections. The first thing I tell my patients is hydrate. It's really important to drink at least 2 litres of water a day, which is equivalent to 8 normal glasses of water, and the reason for this is to flush out the bacteria that may be sitting in your bladder. It's important to consider the types of drinks you're drinking. We all love our tea and coffee. However, tea and coffee contain caffeine, and caffeine is an irritant to the bladder, which may make you urinate more frequently. We also need to avoid sugary drinks. Bacteria likes to grow in sugar, which may lead to urinary tract infections. My second tip is the importance of hygiene. Whichever type of catheter you're using, hygiene is really important. We can become complacent over time, so it's really important to remember the advice given to you by your specialist nurse and doctor. The key points to remember are washing your hands and cleaning the area. Sometimes patients ask me, do they need to wear gloves when doing intermittent catheters? No, you don't have to wear gloves, but ensure good hygiene technique. A lot of intermittent catheters today have protective sleeves. The protective sleeve is there to protect the catheter from bacteria that are on your hands. My third tip is about nutrition. Nutrition is an important factor in preventing urinary tract infections. Tip 4, choosing the right catheter. There are a range of different intermittent catheters on the market to suit different requirements. When choosing the right catheter, you need to consider your hand dexterity, level of cord injury, and how you transfer. Most importantly, you need to consider how to reduce the risk of urinary tract infections. The key to reducing infections is a good non-touch technique. By choosing a catheter with a protective sleeve, we can prevent the bacteria from adhering to the catheter. Choosing a catheter with a protective tip prevents the bacteria being pushed into the bladder. This will reduce the chance of urinary tract infections. Choosing a catheter with an integrated bag enables you to monitor your urinary output. Hollister's VaPro range of intermittent catheters have all these key features. My final tip today is to respond quickly. At the first signs, if you're becoming unwell, please contact your GP. Things to look out for would be increased spasms, cloudy and smelly urine, high temperature, and generally feeling unwell. When speaking to your GP, you must inform them of your level of spinal cord injury, your type of bladder management, and your symptoms. This will help you get quick and appropriate treatment. To recap, my top 5 tips are hydrate, hygiene, nutrition, choose the right catheter, and to act quickly. Thank you all for listening. My name is Deb Davies. I wish you good luck in the future with your bladder management, and remember, believe in yourself.